Good evening, and welcome to this program here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming at blackdoctor.org, and this is our ongoing series called Seeing Eye to Eye in partnership with the National Eye Institute, the Children Vision Equity Alliance, as well as the Prevent Blindness. I want to thank all of our partners for putting on them. This is a monthly series that we began last year, and it's just been such a huge success. I would say personally as well as professionally, because as we know, we're Black Doctor. We talk everything about Black health, but we don't really. We hadn't before we started this series. We hadn't really talked about eye health, and so this series has been eye-opening, pun intended, for us and for a lot of our audience. And so we were going to continue. We're happy to continue this on here in Black History Month. So tonight's program is really, really interesting because we're talking about low vision, right? And this is Low Vision Awareness Month. And I did bet y'all didn't know that low vision had a month, but it does. And so we've got some great specialists here to talk about low vision. And we're going to talk about the difference between low vision and vision impairment, because apparently there is a difference. So I'm going to be just like you. I'm going to be learning while I'm talking and trying to get an understanding of what's the difference between low vision and vision impairment. And we've got the best people on this show tonight to talk about that. So who are they? Let's find out who they are this evening. But before we begin, there's a couple of things I want you to do for me. Number one, I want you to like and share this broadcast. If you know somebody that needs this broadcast, that needs this information, that's experiencing some low vision, or if you are yourself, share this broadcast, like the page. Also, let us know where you're watching from. We like to know where people are watching us from all over the country, all over the world. And so please just drop that in the comment section. Let us know where you're watching from. And then finally, if you have any questions, also drop that in the comments, because we can try to get as many of your questions asked as answered, because this program is all about you. And we got to get you, your eyes, the healthiest they can be. So who do we have on screen? Up top, we have is Dr. Susan Primo. She is a professor of ophthalmology and director of optometry services and low vision services at the Emory Eye Center at Emory University in Atlanta. She specializes in vision rehabilitation to assist visually impaired patients through the evaluation and prescription of low vision devices. Now, Dr. Primo has a lot more, but we want to be able to get to the questions. So I'm just going to but let me just tell you, she's very, very qualified to talk to you all tonight. All right. And the other pair that you see sitting together there, that is Dee Adams Budgewater. She is currently serving as president and CEO of Lighthouse Louisiana, and she has dedicated more than 30 years to public service, leading state government teams to improve healthcare and social service outcomes and make a positive difference in the lives of others. Praised for her transformative and inclusive leadership style, Ms. Budgewater has been touted as a visionary, there's a pun, results-driven leader with a wealth of knowledge in federal and state government programs that provide assistance to marginalized and underserved populations. And finally, we have Ms. Carmen McLean. She has been a dedicated professional in the field of blindness and low vision since 2011, when she completed the graduate certificate in low vision rehabilitation from the University of Alabama, Birmingham. In 2020, Carmen completed a second graduate certificate. That's right, she's educated. And she became a certified orientation and mobility specialist. Carmen has been working at the Lighthouse Louisiana in various capacities since 2013. In 2020, she took a permanent position as a low vision occupational therapist at the Service Center in Baton Rouge. She provides direct training in vision rehabilitation, orientation, and mobility, and independent living skills, mainly to adults in different stages of vision loss. Good evening and welcome to you all. Thank you for joining us. That y'all can come off mute to say yes.
Thank you for having us. Thank you.
That's fine. Okay. So Dr. Primo, as I mentioned in my opening, February is Low Vision Awareness Month. Tell us, what does low vision mean, and what does visual impairment mean? And then you also talk about the visual impairment among children and adults.
Yeah, well, so good evening, and thank you so much for having me to share this most important information. So to set the stage a little bit, or the landscape for our listeners or viewers, there are many causes of vision or vision loss and impairment globally, most of which can be corrected for with medical or surgical treatment or conventional vision correction, like glasses, like I have now, and contact lenses. But it's important to differentiate those causes which are treatable or curable from what we're going to talk about this evening. So, for example, across the globe, refractive error or needing glasses and cataracts are still the main causes of vision impairment, but both can be treated if there are proper resources and workforce. Even in the United States, which is a supposed high income country, over 80% of vision impairment can be eliminated or reduced with proper access to comprehensive dilated eye exams and intervention, and that includes children and adults. However, what we're talking about this evening is the low vision and the visual impairment that unfortunately can become present after all interventions have occurred and a person is left with reduced visual acuity or significant visual field or peripheral vision loss. I should say that we are moving away from the term low vision a bit, as it can sometimes be confusing for people, especially those who may have had a stroke or traumatic brain injury, or again, their peripheral vision or other aspects of their functional vision have been affected. So more and more, we are using the terms visual impairment and vision rehabilitation, which we'll talk about a bit later. But the main causes are from eye diseases like macular degeneration, diabetes-related retinopathy, and glaucoma. And by the way, this is Age-Related Macular Degeneration Awareness Month as well.
All right. All right. And what about that distinction between, is there a distinction between children and adults when it comes to vision impairment, or how it presents itself or anything like that?
Well, vision impairment can affect children and adults, unfortunately, both. And so we're seeing most of the visual impairment coming from age-related conditions like glaucoma and macular degeneration and some of those things. However, diabetes-related vision loss is definitely the number one cause of vision impairment in working age adults, so a younger population. And in children, we are beginning to see some increase in some hereditary conditions like Stargardt. There's one called inherited retinal diseases, things like retinitis pigmentosa. But as I said, unfortunately, vision loss and vision impairment can affect both children and adults.
Yeah, that's unfortunate. So what type of eye conditions do you most often see in your low vision optometry program at Emory?
Well, I'm at a large academic medical center like Emory here in Atlanta, really a hub here, and we see all sorts of things. I am not a subspecialist, as we call them, that as like a glaucoma specialist or retina specialist, but in my vision rehab practice, I see lots of different diseases, again, unfortunately. So we can see anywhere from, as I mentioned, some of the inherited retinal diseases, which tend to be a little bit more uncommon, but can be common in the patients that we see, to the more common causes of vision impairment, like macular degeneration and glaucoma, and then diabetes-related eye disease.
Yeah, and if those don't remember, at the end of last year, we did a 6-part series on diabetic retinopathy with Dr. Joseph Coney, and he did a wonderful job of really kind of talking about the relationship between your vision and diabetes. And I became so fascinated by what that process is and what they can see. Again, we're going to have all these puns tonight, so I'm going to stop punning. But what we can see through just really getting an eye exam. There's a lot of illnesses and conditions that can just be identified even early through a simple eye exam. So your eyes are truly the window to your soul. So, Carmen and Dee, what type of rehab or visual impairment do you all see at Lighthouse?
Me too. Maybe when I first started at the Lighthouse 19 years ago, it was mainly macular degeneration. But recently, maybe the last couple of years, it's hand in hand with glaucoma. Those are the two. And the younger, if my client is going to be in the early 20s or 30s, it's usually because they have diabetic retinopathy, usually a type 1 diabetic.
Type 1. Okay, so that's the one that they're born with. So just for those that, as a refresher, there's 2 types of diabetes. Type 1 is people that are born with diabetes, somewhat develop in childhood. I think that's young age. And then type 2 is kind of, Big Mama gets sometimes when she eats too much sugar. So it's really just to kind of the layman's terms of how the difference between type 1 and type 2 diabetes. So and there's more cases of type 2 in terms of like what's out there in the world. And so, and type 2 is preventable. So, but we have to exercise, eat right. Some of it is there is a heritable content component to it, but for the most part, it is preventable by what you do, what you don't do, and what you eat. So, Dr. Primo, what is the connection between chronic illness, which is what we were just talking about, vision impairment and blindness?
Yeah, and I was just going to add to what you were saying about diabetes, whether it's type 1 or type 2. But we know research definitely shows that the impact from diabetic-related eye disease definitely occurs at a higher rate the longer you have diabetes. So that's why, unfortunately, we see some of the more severe forms of diabetic retinopathy in those that are type 1, simply because they've had the disease for much longer. But however, there are those that have type 2 that can also have problems. So clearly, duration is a factor in the type of diabetic retinopathy that one can get. But we know that there is an intersection, like we're talking about, between chronic diseases like diabetes and high blood pressure, hypertension, and visual impairment. And the medical and vascular conditions can cause significant changes in the eye. Unfortunately, African Americans, we as Blacks, have higher rates of vision impairments and blindness, primarily from conditions like glaucoma and diabetes. And in the elderly, frailty is increased with slips and falls in those who are visually impaired. And research has also shown that hospital stays are longer for people who are visually impaired and blind. And we also know there's a higher rate of depression, anxiety, and social isolation in those with untreatable and permanent vision loss. So again, it's important that people get comprehensive, dilated eye exams at frequent intervals, or intervals appropriate for their age and their risk factors. The whole concept is to try to prevent some of these diseases from happening.
Absolutely. And so what is that? So just a refresher for our audience, at what age and how often should you be getting that comprehensive dilated? Because that's the operative word. Dilated is when they put the drops in your eyes, and you have to put the blue blockers on, the glasses on. You got to put those on after you get that dilation. But that is a full eye exam. Okay, so how often should people be getting it, and at what age should that start?
Well, let me just say it's important that we tell the listeners that we don't dilate you to cause grief. I hate getting dilated myself, okay? So we know it's difficult because you're blurry for 4 to 6 hours. So we're not doing that on purpose, but it allows us to see the back of the eye so much better so that we can detect some of these diseases, and that's why it's important. So definitely, a child should have an eye exam before they enter school. There are different schools of thought on that, whether it should be, at age 1 or 2 or closer to age 5 when they enter kindergarten. And then, every few years, assuming that they don't have an eye problem, that it can be every few years or so. As we get older, then the incidence and prevalence of diseases just becomes more common. And so things like needing glasses and all those sorts of things then begin to tell us that we need to probably get an eye exam once a year, just to make sure that our prescriptions are accurate, whether it's children or adults. And then again, as we get into our 40s, again, we need to get some reading glasses to be able to see. I'm older than 40, by the way, but I thought I could say that. But we need to get some reading glasses. And then, again, the key, though, is that you assess your risk factor. And so if you have somebody in your family, that's why it's important that we share information with our family about our eye problems. If we have glaucoma in our family, that means we're more at risk perhaps for developing. It doesn't mean that you'll actually get it, but it means that you're at higher risk. And so someone who knows that they have a higher risk then should get their eyes dilated and examined more frequently. So I think it depends upon age and risk factors, but definitely a school-age child should have an exam before they enter school.
Absolutely. And just to remind our audience, if you just joining us, last month, January, was Glaucoma Awareness Month, and we did this program was about glaucoma. So you can go back and watch that program, because I know, and we answered a lot of questions. We even got down to the nitty gritty also glaucoma. So I encourage you to go back and watch that program. And if I get the opportunity, I'll put the link here in the comment section for you. So, because I know it's very, very common in people of color, particularly Black Americans. And so you want to learn about glaucoma as much as you can. So, Dr. Primo, all right. How do eye doctors help folks with low vision? And what are some of the main questions that folks with vision loss should be asking? So if you start to lose your vision, what should they be asking their eye doctors?
So, again, we've talked about prevention is key. So we want to make sure that people get these eye exams because if we discover the eye problem early, then we can have a chance at treating it and you don't end up visually impaired or with low vision or even potentially blind. So, but we want to know how important it is, your vision is to you in terms of your quality of life. And so how does it affect what you're doing or you can't do? That's one of the number one questions that I ask is that what would you be doing if your vision were actually normal or you were normally sighted? So we want to be able to have a dialogue with the doctor about how it's affecting quality of life and what things like independence are affected. So, at the National Eye Institute and Prevent Blindness, we're really doing a push to educate primary medical providers and the community about vision loss so that the resources can be given, like our websites and the Lighthouse that I'm sure they'll talk about shortly, so that we can start the vision rehab process. So, unfortunately, if vision impairment occurs, we want people to know that they should always have hope and that there are lots and lots of resources out there that we'll talk about again shortly for you and your family. So the key is getting the information, not losing hope, and understanding that it's really a community effort. It takes a village. I hate to say that as a common phrase, but it applies here to be able to help people to maintain their independence and have a good quality of life.
I think we can't stress enough how important it is for people to believe that there is life beyond vision loss and that they can have an incredibly full life. We provide the right skills and services and things for them. They can live a holistic, independent life, and that's important. A lot of people think when vision loss is starting, they panic and they feel like that means I can no longer go out in the community. I can no longer enjoy the things that everybody else does. And that is such a misnomer. That is such a myth. That's not true. We can help. You can learn to navigate. You can acquire all those skills that you need to feel safely navigating in the community. So that's critically important to remember and to stress that there is hope beyond vision loss.
Absolutely.
I'm just sitting there like, wow. I mean, I never really heard somebody say that, out loud. And I think from a mental health standpoint, it's good to hear that because I know personally I would be like, boy, if I had this vision loss, I would be devastated. It would be life-changing or life-altering.
Yeah. It's learning to live a new way. That's exactly what it is. It becomes learning to enjoy the things of life, but do it a different way. And you'd be surprised what people can do. We have an occupational therapist here on staff who's blind. And she is one of the most dynamic people I've ever met in my life. She literally corrects me and tells me when I'm on the wrong street and heading in the wrong direction. And she has no eyesight. So yeah, I have a blind occupational therapist. Her name is Janice Heck, and she's also our chief operating officer. And she oversees operations for the Lighthouse Louisiana, as well as all of our service programs. And she is incredible. She's also an adjunct professor. She does, and I'm throwing that out there to reassure people that because you're blind, take the limits off. You can still live this incredible life and do things that have people in awe. So yeah, there's a lot that can be done. Blindness doesn't stop you from living life to the fullest.
Okay, so while we're talking to you, Carmen and Dee, we're going to ask this question. So what is vision rehabilitation and who are the specialists that provide that care?
Well, vision rehabilitation, you have to know that it's not that it's going to cure your vision or cure your eyes. It's more like to improve your ability, the things that you want to be able to do, what Dee was talking about. When I am doing vision rehabilitation, I'm an occupational therapist, and I think that as an OT, helping people become independent, is truly being an occupational therapist. I'm doing occupational therapy by helping people who have lost their vision be independent, doing their occupations, what they want to be able to do. I'm just repeating what Dee said. But you have to realize that people who are needing our services, they need rehab, but in a different way. I mean, they can get dressed, but they may not be able to match their clothing, or they may not realize that their blouse is inside out. They can cook, but they may not be able to tell if the chicken is fully done, and put it on their plate when it's still bloody. They can walk, but they're still maybe tentative or using their toes to see if there's a step there in front. And so the rehabilitation is different. I mean, you still want them to be independent in all their activities of daily living, or all of their, whether there's work or their schooling, anything. So vision rehab, I guess to begin with, if you want to consider what do we do visual wise, is try to maximize that remaining vision. I don't know, if everybody knows, but when we think of blindness, a lot of people think it's, you can either see or everything's black. But no, vision loss is in a spectrum. You can have just a little bit of vision loss where glasses, help you, or all the way to blindness. And most people, they actually say that only like 15% of our people who have a visual impairment are completely blind. All the other ones, they might have some vision that we can work with. So specifically for people who have macular degeneration, where the central vision that's lost, the retinal, the peripheral part of the eye, the side part of your peripheral vision may still be healthy. And so we can teach people how to use that vision, and we call that eccentric viewing. Some people, know it as I see through to my side vision. So part of vision rehab could be helping you see with your best vision, because even if you're using a magnifier, you have to use the healthy part of your eye to look through the magnifier. But it's not only vision related, so we also help people to learn how to adapt their home to make it either more visible or brighter or more contrast so they can see better, or they just need more lighting on their task. If they're trying to cut something on a cutting board, do I need to put, if you have a cutting board that's black and white and you're trying to cut an onion, you might use the black side of your cutting board so that you even if you can't see clearly, it's easier to see an onion when it's on a black surface, And if you're cutting a cucumber still with a green skin on it, you might flip, do your cutting board white, and that way when you're cutting, you can have a sense, you can see that cucumber easier. And so, so those are some of the techniques that we address, but it can be with meal preparation, it can be with grooming, how to tell if you've shaved correctly, or if your makeup, like that. So that's why I think it's occupational therapy, vision rehab. Any occupational therapist that wants to go into vision rehab, it just fits naturally. But what we do is just using different methods and techniques to help people be independent.
So Dee, is that universal amongst all the Lighthouse across the nation? Is that universal? What happens?
No, it is not.
Okay.
First, let me just begin by explaining every lighthouse is different. Not every state has a lighthouse. Now, every state does receive funding from the federal government for the older blind population to be able to care for them and provide those services, but every lighthouse is different. Here, we are the only low vision occupational therapy clinic. We have the only one in Southeast Louisiana where we provide, and Corman operates the clinic here in our Baton Rouge location. And in New Orleans, we have other occupational therapists there that work in our clinic in New Orleans. I think Carmen described it very well. And what she was describing when she was talking about, how to safely cut an onion and how to cut a cucumber, where she's going is those are typically independent living skills. We do that training here on site. We have a full service classroom in both locations where we provide those sorts of services. And those are services where people can still prepare meals for themselves and still do everything in a safe way once they're trained to do it. So lighthouses can be very different. They can provide an array of different services. They have different funding sources. Some are actually nonprofits the way we are, but there are also some that are quasi-government entities. So they do have some state funding that is supporting them and their programs and services. But here at the Lighthouse, we have a very robust array of services. There's the orientation and mobility. That's for helping them to safely navigate those kind of things. Like Carmen mentioned, independent living skills. We also do functional vision assessments. We can do work site assessments. Carmen can see them in the clinic and assess. She can actually go out to a home and assess what modifications they may need to ensure that they can navigate safely. We also work with families, because a lot of what happens is it can be not just traumatic for an individual who's losing their eyesight, it can also be traumatic for the family. And we have to work with families to help engage them so they know what's appropriate, how they can help them to be independent, and yet help them to stay safe. So we do all of that. Here at the Lighthouse, we also do things like we have our transportation service, where we literally will go and provide door-to-door transportation for a lot of people who need our services. We go and pick them up, we bring them to the Lighthouse to get those services, and then we deliver them back to their home safely. So there's a lot of things that different lighthouses can do, but everyone has a different type of service. We are a 108-year-old organization. So our service arrays have changed over the years and we've modified over the years, but vision rehab is core to our mission. So these are the services that have, we're always going to sustain, because these are the ones that are truly core to the mission of the Lighthouse.
Absolutely. That's fantastic. So Dr. Primo, are those similar services that you offer at your clinic at Emory?
Well, I think just as Dee said, different agencies or academic medical centers may do different things. And so what I kind of teach our residents and students in Emory is exactly what was described, as that vision rehabilitation is a multidisciplinary team approach. And it's really aimed at helping an individual, as been already said, improve their quality of life and regain independence and independent skills. And so it's not just me as a doctor that maybe be prescribing some tools and specific devices, but it's all the professionals, that Carmen and Dee have talked about, from the doctor to the occupational therapist, the orientation mobility specialist, and teachers of the visually impaired in our schools. They are very robust here in Georgia for being able to help our children in the school who may have a visual impairment, to help keep them, mainstream, so to speak, so that they don't have to go to a school for the blind or anything like that. So, I think the way to think of this is that just like if you have a broken leg or you have a stroke or something like that, you have to go through rehabilitation to regain function. And that's from lots of different professionals, like maybe a physical therapist, a speech therapist, and all those other ones. So like a truly multidisciplinary team approach. And that's actually what I'd like, everybody to remember, is that it truly is multidisciplinary.
So how does somebody get started? If they start to notice that their vision is starting to dim, if they're starting to have some impairment, how do they get started in engaging in services?
I would say the best place to always start with their eye care provider. Start with their eye doctor. They need to first determine what their visual acuity is and what services are actually appropriate to meet their needs. Most eye doctors are aware of community resources, and they can make referrals directly to the right resources. For instance, we have established relationships here, both in Baton Rouge and in New Orleans, with different doctors and different eye docs and ophthalmologists, and they can make automatic referrals to us. So I would always say, start there. Your eye doctor and making sure that you're getting those routine eye checkups are just as important as going to your primary care physician for your regular physical checkups. So I think starting there is always the best place to start.
So we've got a great question. I'm going to kind of veer off our path just a little bit. We got a great question coming in from one of our viewers, Kareem, and she's asking about Graves' disease. And she says she's also a diabetic and she has high blood pressure. So she's got two of those vascular kind of illnesses that you were talking about. But she says, does Graves' disease cause your eyes lashes to be a problem?
Eyelashes. Graves' disease and thyroid eye disease basically is what I believe she's asking about, can cause lots of things in the eyes, obviously lots of things throughout the body, but lots of things throughout the eyes. And losing eyelashes perhaps is one of those. I'm certainly not an endocrinologist or a specialist for that, but that can cause protruding eyes. It's called exophthalmos, where the eyes can protrude and the muscles can become very large and unable to move the eye appropriately. So I think, again, the most important thing is making sure that she is connected with a good eye doctor who can help troubleshoot some of those things to make sure that they can be treated and managed if they do occur.
Absolutely. Yeah, and you kind of spoke about, so we use the big term vascular. So help people understand what does vascular mean?
Well, vascular would be the blood supply in the body. And so when you have a process like high blood pressure or a process like diabetes, where the vasculature or the vessels, the blood vessels are affected both in the body, throughout the body, ultimately they can become impacted in the eye. And so when you have different vessel or vascular disease, it could be anything from slow moving blood supply, like a stroke where you don't get enough blood supply to the brain, to leaky blood vessels that you see in diabetic eye disease. And so all those types of things are very important. The eye is what we call an end organ. What that means is that we can see a lot of the things that are happening within the body in the eye. It is the most unique structure where we can actually see what's going on without invading the body. So we can actually see some things that are going on, like I mentioned, from high blood pressure to diabetes and other conditions.
Absolutely. So we live in a society that is enamored with technology. As I'm sitting here right now, I've got about 5 pieces of technology around me all together, from the ring light to my iPad to everything that's going around. So Dr. Primo, I know there's probably some technologies that are helping people with low vision or have visual impairment. What are some of the technologies that can assist people, and what are some of your favorites in that?
Well, I think there are lots of tools and technology out there for people who are visually impaired and blind. And I know that Dee and Carmen will probably talk about some of those, but from simple handheld magnifiers, to telescopes, to even virtual reality type headsets we're using now, and something called OCR, which is optical character recognition, basically text to speech. And I know that they will talk about some of the things, but we call some of the advanced electronic devices assistive technology. And those are things like reading machines, monitors where you can actually put your reading material underneath it and it's projected to a large monitor so that it's big enough or can be zoomed big enough to be able to see it. So there's lots and lots of things out there. And even I think a smartphone was mentioned. That's an excellent example of assistive technology because it can be used like a magnifier. Everybody knows on their phone, you can zoom it and you can take a picture of it and you can actually see it more in detail. But also there are lots and lots of apps for both iPhone and Android. I'm an iPhone person myself, but no offense to the Android people, but there are lots of apps out there that can be downloaded to really help with quality of life. There are things like wayfinders, as I mentioned, speech to text, and even artificial intelligence, where you can actually have an app that you hold your phone up and it will look at your surroundings and describe to you exactly what's there without you actually having to see it. Wow. So I'll let them talk about some of the other things. I won't say that I have a favorite, but I will say that there is definitely a boon in the area of more virtual reality and augmented reality type headsets where you can again have on this headset and be able to have things incredibly magnified so that you can see people, see televisions, read, do all these sorts of things. Usually we reserve those for people who have a little bit more advanced vision loss, but there's lots and lots of tools out there.
I think Dr. Primo covered most of the optical aids. There are truly optical related aids and non-optical. We have in fact, in both locations, we've got a visual aid store, and we carry some of the optical aids that Dr. Primo mentioned, our CCTVs and our big magnifiers, electronic devices and things, but we also carry a lot of the non-optical aids, something as simple as a talking clock or bump dots or something like that. And Carmen, I'm sure, can relay a lot of this too, but there are so many tools and aids out there to help people who have visual impairments. And our store, literally, we can provide those things. We consult with them and we provide it. What we will say, and what I would think is important to put out there is we need to be careful in just automatically going directly to the Amazons of the world without getting the proper consultations first, seeing your eye doctor, seeing what is recommended before you do that. Just going online, buying a bunch of magnifiers and things like that, not necessarily a good thing to do, because you may end up making the vision that you have left worse.
Right.
So you don't want to be using something that gives you more eye strain and all those kind of things. So I would say consulting with the right eye care professionals first before you go out and start getting things. But yes, there's just so much out there. And like Dr. Primo has her favorite, Orcams are mine. I love the Orcam device.
Yeah, I am guilty of that. That's why I raised my hand. I'm guilty of that. I will read about something on Amazon, but oh, that sounds good. And the next thing you know, it's, Prime again the same day. And you'll just start, like, okay. So don't do that, guys. Don't do that.
But, there's lots of well-meaning family members that will do that. They'll find something. So it may not even be the person who has a vision loss, but their family member, and they're well-meaning, they're trying to help. But again, there is this sort of a method to the madness, if you will, as was described. I mean, for certain levels of vision loss, we think about certain levels of magnification. So it's best, again, that you visit a specialist or somebody like myself that can sort of tie the visual acuity level to the particular devices. And I wholeheartedly agree with Dee that the non-optical devices and tools are just as important as the optical ones that she's mentioned, because those are incredibly important to be able to, simple things, even a talking diabetic glucometer or things like that. Those are very important tools and devices that will really help quality of life.
So Carmen,
I'm going to go a step further.
Go ahead.
My step further is that it's not only that it has to be well prescribed, like a perfect magnifier, but they need training on how to use it.
Yes.
Because I go to people's homes and they'll open this drawer with all the magnifiers that they've tried or they've used or even prescribed, but it requires training, because if you cannot use your vision normally, then that's why you have low vision. You have to learn how to use it differently. The distance from the magnifier is different. The way you look through your eye is different. So training is also important, even to use a magnifier.
Yes.
Okay. So in that vein, and Dr. Primo kind of mentioned it, talking about family members buying it. What advice would you give to a kind of caregiver, a family member, to teach them how to be more supportive versus an enabler for somebody that has low vision or vision impairment?
So I think I'll start with that. I mean, I think learning, educating oneself about first the condition that their family member may have, how it may affect how they see and what they see, but then learning as much as they can about it. I mean, a lot of these websites like Living Well with Low Vision from Prevent Blindness, as well as the National Eye Institute, the NEI, have really spent a lot of effort, and time in sort of developing these websites and designing them for not just a person who has a visual impairment, because we want to make it accessible for them as well, but for people who are caring, the caretakers, if you will, are caring for people who are visually impaired. And so I would say that if you do have a family member that unfortunately is visually impaired or blind, learn as much as you can. Go to some of these websites, or again, they're not just for people who have the eye problem, but they're also for the caretakers as well.
Let me mention the type of caregiver you don't want to be.
I think that's good.
That would be the overprotective. Okay. Sometimes people come to me, they want to learn, but then they'll have if this is a 70, 80-year-old, then they're 50, 40-year-old children. Don't let their mother do anything. I mean, they don't let them use a knife. They're afraid she's going to cut herself. They don't let her boil an egg. She might burn. So don't be overprotective, especially after if you allow them to come through training. They need to have the chance of practicing what they learn in the class. And so overprotection can be a little bit, can not be good for them. So that's one thing to try to avoid. The other can be unrealistic, the other extreme, unrealistic expectations. They might think that if they come, now they don't have to go visit them anymore or do anything for them, because after training, they're independent, or with vision loss, there'll always be an interdependence. There'll be something to be able to do, but others that you'll still need help. So anyway, so those are two extremes. But then I find some other family members, friends, that are embarrassed. I particularly can think of the cane, the white cane. That they're trying to learn to use the white cane, but when they're going out to the restaurant, say, "Oh, Mom, don't use your cane. I'll just hold on to you. Hold on to me." They're embarrassed by that. Or if they're learning to be independent and getting ready or getting dressed, "Oh, Mom, you put your shoes on the wrong foot, or your blouse is upside down. I mean, inside out." So we need to support the efforts or what they're doing, and not really put them down, but help in that transition of learning, because it is a different way of learning things.
Yeah, I was about to ask. So when is it appropriate for somebody to start using a cane? Because TV will have you messed up. I get it. So movies will have you messed up because all you see is the fully blind person with the cane. So is somebody that has low vision, when is that point where you say they could benefit from using the white cane?
Yeah, to me, one big thing is, if your world has narrowed, you are restricting even going to the mailbox, or because you're afraid of going out your driveway to the end of the driveway. You're afraid of falling. And this is not because of balance, it's only because you're afraid of tripping on something. So it's not only for the people who are completely blind. If you're already doubting yourself, if you're fear of falling, sometimes when there's no contrast, people do okay if there's on the curb, that yellow line, but if there's not that line, everything looks like it's level. So if most people finally come to terms that they need it whenever they're falling, and maybe it's in the public, out in the community, somebody had to help them up, or they fall in too many times. Sometimes they have to fight their family members to say, "No, I really need it. I know you think I don't because I can see certain things," and that's the mystery. Family sometimes think, "Oh, Mom is just playing like she can't see," or Dad, that she sees what she wants to. And that's the mystery about vision loss. Low vision is that it's hard to know what you can and cannot see if you don't understand how it works. And sometimes you just need bold contrast to be able to see things, or good lighting. So some people have no difficulty in a bright sunny day, but if it's dusk or if it's getting dark, that's when they need that cane. So to me, as soon as you start having trouble with or limiting your mobility, you need. The other thing I tell my clients when they come, you say, "Look, learn to use the cane, and you'll have this tool, this technique under your belt. You can use it when you need it. You don't have to use it if you don't need it, but you can carry it with you and have that confidence." So it's just another tool, another thing to have under your belt so you can feel confident.
It kind of also seems like we need to be extending some grace, right? And understanding that everybody's situation is different, right? And so just because they saw something with some contrast doesn't mean they can see, and vice versa, right? Mm-hmm. So we do have to have some patience and extend some grace to somebody that is experiencing, vision impairment. So I'm finding some compassion here as we're moving on in this conversation. So Dr. Primo, there is, Prevent Blindness is one of the co-sponsors of this Eye to Eye series, and they host the Living Well with Low Vision websites. Can you tell us what our listeners can do and what they can find on that website?
Yeah, can I just add one comment though about something that Carmen said that I think was so important, and something that I tell my patients is that it's better to learn the skill. There's a skill to learning to use a navigation or a white cane. It's not just you can just go buy a cane and be able to know how to use it. There's a skill to learning how to use it, and that's where we rely on people like Carmen and O&M specialists to do that. But I tell many of my patients who may be a little bit reluctant because either they're embarrassed or whatever the case may be, is to go ahead and just learn this, be open-minded mind and learn the skill now, because it'll be a lot harder to learn it later. And hopefully you don't have it, but it'll be harder to learn it later on. And so go ahead and learn how to do it so that when the time comes, as Carmen said, whether it's in an airport or somewhere that's unfamiliar, on nighttime, whatever it is, when you really want to be independent, you have the skills to be able to do it. So I just want to say that there is a skill to learning how to use the cane, the navigation cane. But yes, as I mentioned earlier, the Living Well with Low Vision website has really been redesigned since last fall. And it's a great resource for those living with vision loss and blindness. And as I mentioned, those with a family member or loved one too. So it's got some updated interactive guides and things like that. So for people who have been diagnosed with macular degeneration and diabetic retinopathy, there's a new section on vision loss and mental wellness. We're really beginning to find that there is definitely a connect between depression and anxiety when you have a vision loss or vision impairment. And again, it's got updated patient and caregiver resources as well. And so, we're also spending a lot of time with broadening and updating the NEI, the National Eye Institute web pages for vision rehab. And I think Hadley also has a wonderful interactive website as well, with virtual workshops. And, the key is that all of these websites, they spend a lot of effort and time to make them accessible to the person who may have a vision impairment. So those are just a couple of examples.
Absolutely. Okay. Man, all right. So there, and we're going to be putting the links to those resources at the end of the program. So just stick around. We've got a ton of resources available to you. So we're not just going to tell you about it. We're going to give you a place to go to after the fact. So, Dee, how can our listeners be advocates for more accessibility for folks with vision impairment or blindness?
I like to tell people, be alert and be involved. Get involved. One of the things most communities, especially here in Louisiana, but all across the country, there are local communities who have set up coalitions and things to improve accessibility, improve transportation, all of those things that we would consider are paramount to living an independent quality way of life. And what you want to do is become involved. Find out about those coalitions and those community events and attend them. The same way we have to own our own health, we have to own the path that we want to see. We have to be the ones who are out there talking about this. We have to be the ones who are engaging around, wait a minute, there's a Complete Streets Coalition. The federal government as well as state government always they will literally hand down money to be able to ensure that we are doing special things for people with disabilities so that they can live a quality way of life. It's the same thing when it comes to visual impairments and blindness. We are here locally in Louisiana, both in New Orleans and Baton Rouge. We've partnered with those coalitions on the local front, and that's literally looking at it through the lens of navigation, transportation, all of those things. Train them, talk to them, tell them, introduce them to the world of vision rehab. I think people a lot of times are standoffish because they just don't know. We're not talking enough about it, but getting involved is important. Here at the Lighthouse, we look at advocacy through a couple of different ways. Self-advocacy, we're always going to promote. Part of our mission is advocacy. So we're always going to be promoting that. But we also look at advocacy from a state and federal level as well. We're looking at policy, changing policies. We have to ensure that we're talking about it. We have to ensure that when legislatures are in session, we are there. We are advocating for changes in our community at the state and local levels. We are advocating for the policy changes we need to see. One of the things that the Lighthouse is really involved in here, and we've partnered all across our state, the country. In fact, we are partnering on this issue. One of the things that has really hindered, I think, moving the needle on vision rehab services, these services do not receive federal funding when it comes through from social determinants of health. And we already know that there is a direct correlation between certain health conditions, like Dr. Primo explained so perfectly about diabetes and things like that. Yet these are conditions that there is funding on the Medicaid and Medicare side for. But the services that are provided in our vision rehab clinics by those eye care professionals and service professionals, they are not covered under Medicaid or Medicare. And I think it is such a tragedy not to see this through a different lens. These services are critically important to sustaining this person's independence, so they should be covered. So that kind of advocacy is something that I think we have to talk more about. There are organizations like Vision Serve Alliance and the Big Data Project. They have come up with a way to start extrapolating data across the country in the United States from different states or plugged in. Louisiana was one of those states that contributed to the first round. And what that data can be used for is advocacy. That data tells our story on the vision rehab side, where we want to go and what it is. And that's how you advocate. You're going to have the data. So anytime you can get involved, and from that perspective, I think that's where we need to go when it comes to advocacy. We've got to change the thought processes, and we've got to change the traditional way of thinking when it comes to vision rehab services. They should be covered just like any other Medicaid or Medicare service.
Well, amen and hallelujah. I am really just really inspired by that, because I think, so much, when somebody loses their vision, as with any type of disability, we tend to push them to the side of society. And that's a tragedy, and we really should not be doing that. And there's a lot of resources and a lot of availability, as you talked about earlier, that they can engage and have a really fulfilling life.
Exactly. And I mean, the services that we provide, it's critical to doing just that, making sure that they have a truly fulfilled life in being able to do what they need to do. But what it does is it puts this unfair imbalance on agencies like ours and nonprofits like in other agencies that are in this space. They want to be able to provide those services because we know there's a need in the communities, but the problem is funding. We can only do so much. We can only stretch our dollars so far. But if we're advocating at the federal level to cover these services the same way we would any other ones, then that changes the game. That's the game changers for us. Policy changes are what we need. And that makes a ripple effect across the entire country, not just here in Baton Rouge and not just here in New Orleans. That is a national-wide thing. It is an issue at the national level, and we have to address it differently. So I think it's critically important for us to stand behind any legislative changes, any policy making that we can do. We need to get behind that. That's what really true advocacy looks like on a broader scale.
Yeah. And don't wait till it happens to you to get involved. I think that's another kind of piece that we should add to that, is that you can get involved before, and so therefore you can become an advocate without being a patient, right? And so there's great to have patient advocates, but it's really important to have advocates that are not part of the low vision or the vision impairment community, so you can stand in the gap for them in some of those spaces. So as we're wrapping up here, it's been a fascinating discussion. I've really learned about low vision, the vision impairment, and all the tools that you're like. The gadget man in me wants to go buy something just to see what it looks like. So I'm not going to do it. My wife's going to get mad at me enough. She's like, all right, if another package shows up here, me and you we got to have a conversation. So I cannot buy any more things, but it's good to know there's a number of resources out there. I was putting some of them on the screen there, lighthouselouisiana.org, and there's lighthouses all over the country. So you can check and see if there's one in your state and what they do. If you happen to be in the Atlanta area, you got Dr. Primo. Everybody knows that we know Dr. Primo now at the Emory Clinic. So I live in Atlanta, so I will be, if I ever have a problem, I know I'm going to see Dr. Primo at Emory, but I will definitely say so. Final thoughts as we're wrapping up here, Dr. Primo.
Wow. I think the final thought I could say is that seek out resources and support networks, including social media and everything. But I think the main thing I would say is that please don't give up hope. There are resources out there to help with quality of life and independence, and please just don't give up hope.
Absolutely. Carmen, last thoughts.
If your doctor does not suggest vision rehab or rehabilitation, you ask for it. Yeah. So it may not occur to them, but say, is there any rehabilitation that can help my vision loss? And you advocate for it.
Absolutely. Andy.
I would say for me, just probably a takeaway from what Carmen is saying, that goes back to what I said earlier. Owning your own health is owning your eye health as well. And be informed. Make it your business to learn about you, your surroundings, your eye health, and own it. Nobody can change the trajectory of your health but you. So I think it's critically important for people to make sure they are scheduling their annual eye exams or however often is recommended by your eye care professional, but keep those examinations and follow up. Don't stop there, follow up. And if you think something is wrong, go with your gut. Make that appointment and see your eye doctor.
Absolutely. Well, this has been truly a pleasure in speaking with you all. Thank you all for taking the time out this evening to join us and provide this really life-changing information to our audience. If you are experiencing some low vision or some vision impairment, please seek help. Seek it now. Schedule that appointment. Talk about what's going on. Your doctor, your eye care specialist is somebody, they're bound by law, but you've got to give them all the information so they can give you the best possible treatment. If you're holding something back, if you're not being completely honest, they can't give you the help that you need. Work with your family, work with your friends, get that regular appointment and advocate for yourself. I heard that many times. Be an advocate for yourself and for people that are in your community. With that, we're going to say good evening. Thank you so much for joining us, and we will see y'all next month on Seeing Eye to Eye. Thank you.
Thank you.
Thank you.